I'm going now to discuss information technology in nursing. First, going to discuss the benefits, and on the latter part of the report, I'm going to discuss the disadvantages of information technology in nursing. First, the benefits. Since in nursing, we are now maximizing the use of technology, so we are learning throughout our curriculum how to operate these applications or machines. The benefits in nursing of technology is first, enhance patient outcome. Second is management of healthcare facilities. And third is nursing education and nursing research. I'm going to discuss each and every benefits in the next slide. First, enhance patient outcome. In enhancing patient outcomes, in help with the technologies and machines that has been created, it has been evident throughout the use of this for over the years. It helps by first, facilitates communication between clinicians. Often in a patient's medical journey, multiple healthcare professionals are involved in their care. This can dramatically increase the potential for miscommunication or error. Communication failures are one of the most common factors that contributed to the occurrence of adverse events. EHRs are designed to help reduce those errors by compiling and maintaining all the patient's health information into one easily accessible record. Second is reduce medication error. Prescribing errors are another common medical error that can potentially lead to serious complication. Electronic prescribing can help reduce prescription errors by allowing clinicians to send prescriptions electronically to the pharmacy. Medical alerts, clinical flags, and reminders are also ways technology can help reduce medication error and improve patient safety. Third is provides access to information. Many serious medication errors are the result of clinicians not having sufficient information about the patients or drug. Information technology has drastically improved the access to reference informations. A large range of drug reference information is now available for handheld devices, and clinicians are able to quickly access textbooks, database, and other medical reference online. The fourth is increases patient-centered care. Encouraging patients to be more involved in their care is important for many reasons, including increased compliance and patient satisfaction. Technology helps contribute to patient-centered care by fostering communication between providers and patients via online portals, text messaging, and email. It also increases access to information such as online medical records, which can improve self-monitoring and self-convenience. Information technology can have a substantial impact on patient safety. As with most technology, there may be benefits and potential concerns with any implementation of use of healthcare technology. It is critical patient safety and quality always remain for primary focus. Second is management of healthcare facilities. Medical technology has changed so much over the last several years that now it is incorporated with the clinician's workflow. Information captured by a medical device is automatically entered into an analysis software for real-time review by clinicians. Technology is used for diagnosis and treatment of the patient, but now decisions are being made much more quickly about how to care for the patient based on the information captured by devices. Bedside devices such as a vital sign monitoring or some ventilation technologies are being used by the primary caregiver or respiratory therapist to make care delivery decisions at that moment. This affects the design because you need to have equipment placed within the room at the most appropriate location. The Situation used to be that the equipment was in the room, you bought it over, you used it, and you put it back in the corner. Now we have equipment that's being used throughout the caregiving process, so we put equipment columns and equipment booms in more patient rooms because the equipment needs to be with the patient. Third is in help with nursing education and nursing research. The use of technology in nursing gives students and also working nurses instant access to drug reference, diagnosis, medical textbooks, and more using apps and online guides on smartphones and tablets. Advances in computer-based technology have become an important aspect of nursing research, with emphasis on innovation and research by funding agencies including the National Institutes of Health. Nurse research are attracted to innovation computer technologies. Also, there are also disadvantages when using the technology in taking care of the patient. First is malfunctioning equipment, power outage, lack of attention to detail, and security breaches on privacy. With the advancement in telehealth, nurses and advanced healthcare providers can provide health information and care to patients in rural settings from a distance. First is set up and internet access. An important disadvantage of technology in nursing is that some patients may not be savvy with technology. Some patients may not have mobile phones or internet access, making applications and video visits useless for them. While this may not be a total disadvantage, it is rather important barrier that nurses and other healthcare professionals must keep in mind when using technology to revolutionize patient care and interaction. Second is potential lack of attention to detail. Perhaps the biggest disadvantage of technology in general is that people can come to rely on it a little too much. This means that because their technology is supposed to be fastest, smartest, and most accurate, they are less likely to question it or think for themselves when something seems off or is inaccurate. While technology in nursing should lead to fewer medical errors, there is no guarantee that it will eradicate all errors. Human efficiency and thought are still important, which is why nurses, doctors, and patients must remember that technology does not always have the final say. There is plenty of room for errors, and all diagnoses, treatments, and care plans should be doubled and triple checked to ensure safety and accuracy overall. So I have discussed the importance and disadvantages of information technology in nurses. Now that we all know the both sides of this, we are now aware of the things that might happen, or we could prevent it for some reasons. Thank you.